Murfreesboro Medical Clinic knows you have a lot of questions about hematuria or blood in the urine, and we are here to help you every step of the way.
Hematuria, quite simply, means blood in the urine. Now there are two types of hematuria. One is gross hematuria. And when we say gross hematuria, we don't mean that it's simply gross looking. It means that we can see the blood grossly with the naked eye. The other kind of hematuria is microscopic hematuria, and that is urine that does not appear to have blood in it when you look at it, but when it's examined under the microscope, we can see red blood cells.
The causes of hematuria vary and range from benign conditions like kidney stones to more serious conditions like cancer.
Some of the benign causes of hematuria include kidney stones, urinary tract infections, blood diseases like hemophilia, and trauma including motor vehicle accidents or falls or potential trauma to the urinary organs. Some of the malignant causes of blood in the urine can be cancers of the kidney, cancers of the bladder, or even cancers of the urethra or other pelvic organs. There's an important distinguishing factor in that we should determine if there is a cancer. Now, with patients that have microscopic hematuria, approximately 5% of those patients are found to have a urologic cancer. Now, patients that have gross hematuria, remember that is blood that you can actually see, have approximately a 25% chance of finding a malignancy. So when we think about those numbers, most patients that have microscopic hematuria do not have a cancer. And up to 25% of those patients, we actually never truly find a cause.
So it is important to discuss this with your doctor. Let's talk about some of the symptoms of hematuria.
Most patients do not have any symptoms at all, particularly those that are found to have microscopic hematuria on a routine physical examination. It's very common for a patient to come into my office and say, "I don't think there's anything wrong with me, doctor. I don't hurt, I don't have any symptoms, but my doctor told me that there was blood in my urine." So for those patients, we start with a typical workup and look at the blood under the microscope to see if they actually qualify as a diagnosis of hematuria. Many patients do not. If they have greater than or equal to 3 red blood cells under the microscope, we then proceed with a workup. Now, if they have risk factors, including smoking, some chemical exposures with harsh industrial chemicals, or a family history of cancers, we would be more aggressive with our workup. The second part of it is actually imaging the urinary tract, and typically we perform a CAT scan or a CT scan, which stands for computerized tomography. And that is an exam that's done similar to an X-ray that does involve an injection of some dye into the vein. After that injection of dye, we take a series of films to look at the urinary tract, particularly the kidneys, the ureters, and the bladder. Now, typically, the lining of the bladder is not seen very well with the CT scan, and that requires us to perform what is called cystoscopy. And a cystoscopy is putting a very soft, flexible camera into the bladder and taking a look at the lining of the bladder. Now, when we do this, we're looking for any causes that could include stones or potential tumors.
The CT scan and the cystoscopy allow us to get a good look at the urinary tract and surrounding organs. Treatments vary depending upon the cause and range from antibiotics to surgery.
For instance, if a patient has a kidney stone, we may perform laser lithotripsy or shockwave lithotripsy in order to break up or retrieve the stone. If the patient is having urinary tract infections, we would treat them with antibiotics and reduce their risk factors for subsequent urinary tract infections.
Not only the treatments, but the outcomes also vary depending upon the cause of the hematuria.
Now, for instance, if the blood is caused from a stone, the outcomes are quite good. Once we treat the stone, generally speaking, within a few days to sometimes weeks, the blood resolves.
We hope you have found our overview of hematuria helpful, and that you look to us at Murfreesboro Medical Clinic for help with this and any of your other medical concerns. If you still have any questions, feel free to stop by our urology office.